Okay, welcome back to K24 this morning. Thanks a lot for joining us. We appreciate your company. Welcome to the session of Health and Wellness, and this is what we do every Monday on your favorite TV channel. My name is Shiko Kaitani. Remember, we are looking out for you on our social media platforms. Interact with us. Continue to contribute towards our ongoing discussions would be most appreciative. At K24 TV is how you can reach us. We also have a WhatsApp number that's at the bottom of your screen, so feel free, and we will be sampling some of your feedback throughout this live broadcast. Now, sickle cell disease is a blood disorder that causes health problems for those battling the disease. Though World Sickle Cell Day is marked in June, September is National Sickle Cell Awareness Month to help focus attention on the need for research and treatment of the disease. Sickle cell has been described by health experts as an extremely debilitating medical condition characterized by chronic pain. And though it may be a common disorder, many are chasing conversations around it and wondering what will be done to improve the lives of people living with sickle cell. I want to start off by welcoming my guest. We've got Professor Jessie Githanga, who's here with us today. She is a hematologist and an associate professor at the University of Nairobi under the Department of Human Pathology. Welcome to the show.
Thank you.
Seated right next to her is Eunice Owino, also a good friend to the show. She is the founder of the Sickle Cell Uhuru Trust. Karibu sana, and good to see you again.
Thank you very much.
And then joining us via Zoom is Joanna Chazima. She is the founder and director of the Joanna Chazima Foundation. Joanna, if you can hear me, karibu sana to the program. Thanks for joining us.
Thank you so much. Thank you for having us.
All right. So even as we get started, remember we do have our question of the day for you, and we want you to start engaging us on the same. And we ask you, what recommendations would you give the Ministry of Health to bring diseases like sickle cell to the forefront? What recommendations would you give the Ministry of Health to bring diseases like sickle cell to the forefront? At K24 TV, yet again, is how you can get us on all our socials, and there's that WhatsApp number. We'll be looking out for you. But let me start off with you, Prof. You know, just to describe what sickle cell disease is all about, please give us a very simple description and tell us whether it's something that's inherited or not.
Okay.
Yeah.
Yes, so sickle cell is a disease that is caused by abnormal red blood cells. Our normal red blood cells are round in shape.
Yes.
But in sickle cell, they take on the shape of a sickle, and a sickle, which is some agricultural tool.
So it's like, yeah.
Yes. And what happens in sickle cell disease is that the hemoglobin, which is contained in the red blood cells, is abnormal. It is known as HbS. The normal hemoglobin is HbA. And so when a child inherits two abnormal genes for HbS from each parent, one, then they get HbSS. And that causes the red cell to assume this sickle shape.
Yes.
And that is the beginning of all the problems. This cell is not able to carry oxygen properly.
Yeah.
And we need oxygen for our daily lives. You know, when we breathe it in, it goes to the muscles and where it's needed in the body.
Absolutely.
And then these abnormal sickle cells are very sticky. And when they get to the blood vessels, especially those small blood vessels in their organs, they clog up their blood vessel.
Yeah.
And therefore blood does not flow. And because of this, it causes the features that we see in sickle cell, such as pain and swelling in the small children of the fingers and the toes. It also happens in the organs, like the kidneys, the heart, the liver, even in the brain. And then that causes all those manifestations that we see about sickle cell disease.
Wow. All right.
Yes.
Joanna, I want to start off with you and a little bit about your story. You know, you said that going through your whole life or your whole childhood life, you went through it not realizing what you were ailing from. Were you a very sickly child?
Yeah, hi. I don't know if you can hear me very well.
Yeah, we can. Go ahead.
Yeah, interesting enough, I grew up, and until I got to 22 is when I discovered I had sickle cell. Now, it doesn't mean that I didn't have pains and all that. Yes, I was a sickly child. It would take a month, I'm sick again. It would take, and considering where we used to live with issues of malaria and everything like that, it was such a big challenge. So the saddest thing was you're sick, you're in pain.
Yeah.
And now you're treated for malaria, you're treated for typhoid, and your pains don't go away. So that was always, people are wondering what is going on. How come this child is not getting well? You're always in pain, you will take medication, you're not getting better.
Yeah.
So yes, going through that life and not even understanding that I have sickle cell disease, and I wasn't alone. Even my sister would have the same symptoms.
Wow.
Would go through the same pain.
Yeah, so there was a lot of misdiagnosis when it came to your case.
Yes, there was.
Okay.
And I can tell you for free, I'm not alone in this. There's so many other people who've been misdiagnosed.
Yeah.
Not people picking that it is sickle cell disease.
Yeah, okay. Just hold that thought, Joanne, for a minute, because I want to rope in Eunice here, because even for you as a sickle cell warrior, you know, we hear such horror stories when it comes to sickle cell. And I always wonder, did you think that death was knocking, you know, at the door for you at different moments in your life? Because, you know, when you hear about the excruciating pain someone goes through, does it almost feel like it's the end?
Always.
Always.
Always. And that's why we call ourselves warriors.
Yeah.
Because after that pain, you fight.
Yeah.
And then after that, the pain is over, you're well and normal as any other person. Personally, I thank God I had a very good professor.
Yeah.
He is called, I think he has stopped practicing, Professor Francis Onyango.
Yeah.
He was the one who diagnosed me in Kenyatta at the age of 8 months because I lost a sister earlier before I was born.
Yeah.
So when I was born, my parents saw the symptoms that I have and they saw it looks like my sister.
Yeah.
So they decided to do the test at the age of 8 months. So from there, we started the journey. So it was on and off.
Right.
Personally, I can say half of my life as a child, I spent at KNH.
Wow.
And half I was at home. And the KNH I spent my half life growing up was much better than the KNH we see today.
Right. And how has that affected you, like emotionally, mentally, you know, just thinking about your past?
Personally, I can say because I had very good parents who always talked to me. Because I remember there's a time I was in class 3. I was this person who, when you make me mad, I'll just smile at you and hold things inside. Until that time it reached when I'm so angry, I feel like I can beat you up.
Yeah.
And I'm very tiny at that particular moment because one of the symptoms of sickle cell is delayment of growth.
Right.
So we don't grow as our age mates and we look actually younger than our age mates.
Yeah.
So I remember we had this talk with my dad and he told me, you're the one who is hurting yourself. When somebody does wrong to you, just walk to them, tell them what you've done is wrong. Don't carry things in your heart because it used to make me sick. And that's how personally I grew up.
Yeah.
And they never treated me as a special child because majority of sickle cell patients, either you're treated as a special child or you're that one who the parents feel you're special because you'll get sick. Because personally, if I touch cold water, that's a way I trigger crisis. And I know Prof will talk about crisis. Crisis is that pain you're talking about.
Right.
It's a pain that is more than, for women I can say, it's more than labor pain.
Yeah. Oh, wow.
It's a pain when you're seeing as if somebody is just cutting you through.
It feels like, someone's ripping you.
Yeah, because that time the cells have come and locked in all the joints. Oxygen is not flowing in your body. You're having difficulty in breathing, and then it doesn't settle. So when the pain starts, it's everywhere is aching. So when that time it's an emergency, when I'm rushed to hospital, what the doctors need to do is first stop the pain.
So
After the pain is stopped, then from there we can find out why am I having this pain? But in our Kenya system, that is not what happens.
So we'll talk about that in just a moment. But getting back to what they have said, both Joanna and Eunice, Prof, is this something, when you talk about a child, inheriting a particular gene, does it cut across all the children? Because she's mentioned her sister, Joan mentioned about her sister, and that's how they knew about her. Same thing even when it came to Eunice. So is it something that you can expect across all your children, should you have?
It actually depends on whether your parents are carriers.
Yeah.
Or have sickle cell disease. But when you have two parents who are carriers or have the trait, they're completely normal. They look completely normal.
Right.
But they have a 1 in 4 chance of getting a child who has sickle cell disease. Half of the children, 1 in 2 chance of getting a child who will be a trait, who will carry the gene, and 1 in 4 chance of a completely normal child with HBAA.
Yeah.
So that is how it is inherited, because when you have two parents, each one being a trait or a carrier, they will transmit one gene that has sickle cell to their child, and if the child gets another gene from the other parent, then that child will have sickle cell disease. So it's a 1 in 4 chance. But then you see for each pregnancy, it's that 1 in 4. Just like when you get pregnant, you have 1 in 2 chance of getting a boy, but you can find a family where all are boys or all are girls.
Absolutely.
So it's a chance.
It's a chance.
Yes.
All right, so help us understand what sickle cell looks like by explaining some of these major features and symptoms.
Yes.
So that we can identify, for those of us who've never interacted with someone who's a sickle cell warrior, what should we look out for?
And that's important because, as they have explained very well, it's unfortunate very many healthcare workers as well don't know how to look for sickle cell disease. So the first symptoms usually come at between 3 to 6 months of age. They may present early, like 3 months of age, especially if there's an infection that comes on. However, most times they present a bit later, about 6 months of age, with swelling of the fingers and swelling of the toes. And that's because of those blocked vessels. They may also get pain elsewhere. They may also they easily get infections, so they present with pneumonias or coughs. And as well, they also come with lack of blood, what we call anemia. So those are the common features that one will see as a child. And if these are not picked up, they will continue. Then later people will notice that the eyes turn yellow, a term we know as jaundice. And this is because those abnormal red cells are quite easily destroyed in the body. And when they're destroyed, the end product is the yellowness of the eyes and even the palms of the hands. And because of the anemia, the child will also be unable to play properly. They will be crying a lot because of the pain, and you will see that it is quite a miserable looking child.
It is.
And as the child grows, as was very well told, they don't, gain weight, and they don't eat as well as the other children.
As fast as,
yes, they don't develop as fast.
Okay.
And they're prone to getting those sickling crises, especially when it's cold or when they have dehydration. And children will play and they don't remember to drink water, so they become dehydrated. That will precipitate a crisis. At night when they sleep, our pH, or the acidity of our blood, tends to increase when we sleep, so that that also will precipitate a crisis. An infection, even a simple cold in another child, may precipitate a crisis in a patient who has sickle cell disease.
All right. We'll talk about, that crisis in just a moment, so that we can really understand what it's like to be a sickle cell warrior. But remember, we are asking you for your feedback today on the show, and we've been asking you about the recommendations that you think, if you had the opportunity, would give the Ministry of Health to bring out diseases like sickle cell to the forefront. We're talking about this being a very common blood disorder, but the question is, how often are we talking about diseases like sickle cell? And that brings me to you, Joan. When we talk about the plight of people living with sickle cell, especially those in informal settlements and rural areas, what can you tell us?
Thank you. It's number one, sickle cell is an expensive disease because if you look at this person having to take medications daily, And I can tell you for free, people in the rural areas or impoverished areas, getting their normal income, their daily income is already a problem.
Yeah.
Now you're telling this person, this child needs special care, this child needs a proper diet. They themselves cannot even afford it.
Yeah.
Medication is an issue that them to get medications to give this person daily is always a challenge.
Yeah.
So I can tell you, it's quite a difficult disease to handle for them. Because when you tell them, make sure this child eats a balanced diet, sometimes they go without food.
Yeah.
So how is it that they can give this child a balanced diet?
Yeah.
You know, things like that. You're telling them this child needs medication daily. A drug like maybe hydroxyurea, maybe this baby has been put on hydroxyurea.
Yeah.
Buying hydroxyurea, maybe minimum in the let's say in the villages, they will charge you about 70 shillings, between 60 and 70 shillings per capsule. Now, maybe they went for the kibarua and they earned 200 shillings. So are they going to buy medication?
Yeah.
Are they going to buy food? And maybe that is not the only child they have.
Yeah.
They have the rest of the family to deal with. So yeah, and now this child will suffer in pain.
Yeah.
They will live a terrible life because now you need to take care of yourself when you have sickle cell, or you need to be taken care of when you have sickle cell.
Yeah. And
when
when you think about the misconceptions around sickle cell, what have you discovered on the ground? What do people tell you from these rural areas or from informal settlements? What are people telling them that the community thinks about sickle cell?
The biggest misconception is that we cannot live past 18. In fact, they start with this child can go beyond 5 years, then beyond 14 years, then beyond 18 years.
Yeah.
So you find that because there's less information about sickle cell, most people don't know about sickle cell, let alone even the ones who are living with the condition. So you find the first thing is death is pegged on you.
Yeah.
That you cannot live a good life, that you cannot survive.
Yeah.
That basically there is no life for you.
Yeah.
Yeah.
All right, Joanne, thanks a lot for that. Joshua, rather, from Kirinyaga is on the line. Let's hear what he has to say this morning. Joshua, good morning.
Shiko, good morning.
Karibu sana.
Asante. Kwanza, allow me to commend K24 for their audio quality.
Okay, thank you.
K24 TV has the best sound quality of all the TV stations.
Okay, thank you.
yes. Now, back to sickle cell disease.
Yeah.
Shiko, now you asked a question, what one will advise the government to do to bring sickle cell manenos to the front.
Yeah.
And I'm sorry to say that, honestly, with our government, I don't think there is hope. Considering that we have a government that cannot eradicate jiggers, we are unable to manage cholera. So when it comes to diseases like sickle cell, which is a very expensive disease to manage, and and its only cure being either a bone marrow or a stem cell transplant, to the common rural folk, to the poor Kenyan, I think once you have this disease in your family, it sounds more or less like a death sentence, or probably it will require an act of God. So I don't think there is much hope really to sell to Kenyans, other than just to pray that you're lucky that this disease doesn't run in your genes. Otherwise, relying on the government really will be a long wait.
Thank you, Joshua, for that. Eunice, listen to what Joshua has to say. There is this lack of confidence in the Ministry of Health to, you know, more or less plug in to some of these conditions that we hardly talk about. And Joshua puts it very clearly that, first of all, what are we doing on the ground? And I want you to add on to what Joanne was talking about when it comes to the misconceptions that people have about sickle cell. Because number one, they don't know what it is. Number two, you've never seen it. You have not, you know, experienced it or met someone with sickle cell. And you are nodding because it seems like you've seen a lot.
A lot.
You've seen a lot.
I've seen a lot with my 30+ years.
Yes.
And I'll not lie to you. As Sickle Cell Uhuru Trust, we are supporting over 500 families.
Yeah.
Reason being, they can't afford the basic thing of just even medication. Then number two, the misconceptions around sickle cell.
Yeah.
Dr. has said, but there are families I know in the rural areas, because there is where I do a lot of advocacy.
Yeah.
So this time, I think during COVID is when I was thrown to do advocacy a lot in Nairobi. Those areas, you find a family, they have 5 children, all of them have sickle cell.
Oh, wow.
Because people don't understand. It's a blame game.
Yeah.
It's from your family. The husband will blame the wife will blame the husband. And the extended family will start blaming the two of you. So basically what I say, since Kenya, we are not yet privileged to do a genotype test for each and every person, which is very important, like other countries in Africa who are doing it for free. We are not yet there. But I always tell people, if you know that you don't get malaria, basically you need to check your genotype. Because how sickle cell came about is, it was a mutation from the people who are not getting malaria. So the people who don't get malaria and they have like that mutation to defend themselves from not getting malaria, they're the carriers of the gene. So when you are a carrier of the gene, then definitely if you marry another carrier of the gene, that's how you end up getting children with sickle cell. And right now with intermarriages, in our database, we have people all over Kenya. So it's no longer a Nyanza, Western, or Coast disease.
Right.
It's all over. Till sometimes you find families are fighting like, I'm Kikuyu. How come I have sickle cell? Sickle cell used to be a Luo disease, a Luya disease, or a coastal disease.
It is surprising to see how people think around such diseases.
And then there's also this myth which growing up, I had people talking about. Definitely they don't talk about it on your face. Jamie Dekre, that's a name you're given. An always sickling person. A person who is always in the hospital.
And by the way, people used to pray for you, say, oh, you're about to lose.
It's witchcraft.
You're about to lose Eunice.
Yes.
Oh,
it's witchcraft. They don't believe that diseases just come. It's witchcraft. And then also, last year when I was doing advocacy with Joanne at Korokosho, then this guy tells me that, no, ugonjwa inakuja usiku alafu shetani anavuta damu.
Okay, wow. On that note, let's just take a look at what's up, because I'm shocked. Like, I'm even speechless about some of these things you're hearing on the ground. Someone says, good morning, Shiko, and the panelists. I'm glad you're talking about sickle cell anemia. It's usually a bad disease, but it requires quite a good support system to conquer it. Love the discussion. Stacy from Kahawa West, thank you so much, my dear. We appreciate it. Let's see who else we've got here. Good morning, Shiko. Can Prof explain why sickle cell is more prevalent in Nyanza? Wow. Okay, what causes strokes in sicklers? Okay, that's a good question. So, Prof, over to you. But before that, hi, Shiko. It's Susan in Mombasa. My memory of turning 18 was being given this yellow paper that stated I am a sickle cell carrier, and my dad telling me to be careful who I marry. It was not explained other than a cousin of mine who is a warrior being an example. Wow. Okay. Let's start off with you, Professor. Very quickly, you can answer those two questions. What causes strokes in sicklers? And I want to believe the other question, obviously, was about genes, inheriting it, rather.
Okay, I'll start off with what causes stroke in sicklers.
Yeah.
As I explained, that these cells that sickle are very sticky.
Yeah.
And they go and they will block the blood vessels, even in the brain.
Yeah.
When those blood vessels in the brain are blocked, that means that area of the brain that was supplied by the blood vessel does not function properly. And therefore, that causes a stroke.
Yeah.
And it can affect, it can either be you have hemiparalysis, the leg and the arm, or the leg or part of the face, depending on where that blockage occurred.
That can turn deadly.
Yes, and that's one of the most deadly things. And I would like to leave people that, yes, we can detect before the stroke occurs. it can be predicted. In young children between 2 to 16 years of age, if they have, it's a special test called transcranial Doppler. It's like an ultrasound of the vessels going to the brain.
Right.
And by detecting abnormalities in flow way before the stroke occurs, we can then advise the patient and the doctors looking after the patient that this stroke is going to occur.
All right.
And prevent it.
All right, Professor, I want us to take a short commercial break. Eunice too and Joanna, if you can hear me, we'll get back with more of your questions on sickle cell for the professor. And of course, Eunice and Joanna, being sickle cell warriors, can also tell you a thing or two about this condition. You're not alone. The most important thing that I want to emerge at the end of this conversation is how you can form a support group and find that support system for you or for a loved one who is battling sickle cell. But remember, we do have the question of the day for you, and we've been asking, if you had the opportunity, what recommendations would you give the Ministry of Health to bring diseases like sickle cell to the forefront? What recommendations would you give the Ministry of Health? And remember, our socials are there, and so is our WhatsApp number. We'll be back with more on sickle cell disease.